Welcome to Metabolic Matters podcast, where we embark on conversations with thought leaders, disruptors, change agents, and passionate souls. Together, we'll delve into what truly matters to them. And you'll learn how to metabolize this newfound wisdom so you can transform your own metabolic health. Now let's meet today's guest. What a treat. I mean, come on. This is so exciting to have this amazing human being before me and before all of you today. I had the distinct pleasure of first seeing this person, hearing this person, and just even feeling this person. Must have been in 2016 or 17. I was trying to figure out the exact dates of this. But the very first time I was made aware of this beautiful human being, Dr. Loren Nations, was at a metabolic health summit that was being presented and co-hosted with Dr. Dom D'Agostino, really well-known, established researcher in the metabolic space in general and the metabolic oncology space in particular, where he and the University of Southern Florida were holding this event, which we're now into the 8th year since that first one happened, in their 5th conference that we just came back from a couple weeks ago from Tampa for the 5th big metabolic health summit that went from about 75 people the first time I went, maybe 150 people when I first met you, Loren, to well over 1,000 today for this gathering. And so I was enthralled sitting there in the audience, watching you speak, hearing you speak, and feeling what pain to purpose brought you to this place. And so are you willing to tell us a little bit about that moment, that talk, and what brought you there that day? And welcome.
Why, thank you, Nasha. This is just such an honor. I can't tell you how excited I am to have this conversation with you. I mean, you and I go back to the beginnings, the very beginnings of my journey in integrative oncology, metabolic health. And so, just a little bit about me. I've been practicing for over 3 decades, so it's been a long time in the veterinary trenches.
Nice.
I started off as a general practitioner, had some some internship training, and then ended up becoming boarded in what's called American Board of Veterinary Practitioners, which is a species-specific board. I'm board certified in canine and feline medicine. It's an incredible honor to be an ABVP diplomate. I kind of think of our board as a jack of all trades, and I'm not going to say master of none, but we think and see things from a very, very integrated, holistic mindset. So kind of like a naturopathic doctor. We're not so highly specialized that we lose, the forest from the trees. So it gives us a very, very high level and foundational piece. And veterinarians do that generally anyhow. In my experiences as a veterinarian, I was trained clinically as a Western allopathic doctor. I think there's great benefit in that, and I love my training. But during that course of several decades, I just realized that was not serving some of the chronic degenerative conditions that we all see, both in human and animal health. I ended up in a scenario where my wife at the time, my second wife, she was diagnosed with triple negative breast cancer, and it was a very, very difficult path. We looked at and did both conventional therapies as well as looking into what else can we do. There's always something. So we were looking at some of those integrative opportunities and did quite a few of those. We initially had what we thought was great success. Unfortunately, soon after she completed her treatments and had gone through surgeries, we were just a few months, probably 4 or 5 months down the road from being clinically cured. And we found that she had very, very advanced, very highly aggressive metastatic disease in her body. At that particular point, I was so just painfully distraught with how inadequate everything that we had done had not produced better results. We struggled and fought very, very, I think, valiantly. She was incredible in the process. And I reached out and started looking at some of the other options. So I was, introduced to metabolic opportunities through Dr. Dom D'Agostino and Tim Ferriss's podcast. I found Dr. Thomas Seyfried through this process. I read a book called Tripping Over the Truth, actually met Dr. Young Hee Ko in this process, and we tried to help my wife, Danae. Unfortunately, over a period of a very short timeline of only 5 weeks, she deteriorated so quickly. We actually lost her to the battle, and she would have been 37 years old on her next birthday.
Mm.
So that was extremely difficult mentally, physically, spiritually, emotionally. Like every construct of what we feel is something you can feel confident in was ripped out from underneath myself and the whole family, including my education. And so, as a healer, as a husband, as a veterinarian, I felt like I had failed and I felt like the system had failed. And when that happens, when a paradigm shatters, it does allow the light to come in and to be able to start looking for other things without being tunneled and focused on one particular set of or one lens that you've been trained on and potentially lived in for a number of years. And through that, I first looked at veterinary medicine, and I realized that the answers that I was seeking I couldn't find in veterinary medicine. So I went across the fence and I
Mhm.
jumped into the human realm, and I started reading and traveling. And I even found within the human realm that even the conventional therapy that medical doctors are trained on was still just as damaged as I had witnessed and experienced. And so that led me into a more holistic mindset. And that's where naturopathic doctors and integrative healers and a whole host of other different physicians or healing specialists live.
Mhm.
It was through that I did start doing some work very shortly after the loss of Danae with Dr. Young Hee Ko, and we started treating several patients with a compound called 3-bromopyruvate, which is outlined and highlighted in Tripping Over the Truth, which was an incredible experience working with Dr. Young Hee Ko. As it turns out, probably 7 or 8 months after I'm a little baby integrative newbie in this process, I was asked to present at the Metabolic Health Summit beside Dr. Young Hee Ko. So I feel like the portal, I was being thrust and pushed through the portal of this without even knowing what I was getting into. So I
Mm.
stood on stage with Young Hee in front of this incredible group of healers and visionaries and renegades
Mhm.
in trying to figure out what does that new path of health look like. So through that, the next experience we had was at another seminar. Dr. Nasha was speaking at it, and me being quite enthusiastic, I was sitting in the front row and I was scribbling out notes in multicolored pens.
So hard.
We connected immediately. It was like I had met my long lost sister, partner in crime, dearest soulmate. And so that's where our journey started. That was in 2017, by the way.
Just blows my mind of that time frame of you stood up on that stage that first time next to Dr. Young Hiko. By the way, the patients Dr. Loren is talking about were furry patients that he
Furry
applied
patients,
to
correct.
go back into this metabolic molecule that is very powerful in the field of oncology and is still being well researched and hopefully soon will be more applied to the masses, not just in the animal world, but beyond. But that was, you stood there, your vulnerability was incredibly touching to all of us. You were so raw with the loss of Danae and so um, hungry to have her memory go forward in something that's going to help others heal from this and continues to this day, and including bringing in the very special people and pets and partner that you have now who's also on this healing journey of helping impact the global community as a whole in a really powerful way. And so you speak to this piece about how we met and how you started getting interested in the integrative oncology from the human side. And it became really evident early on that you saw an intersection, as did I intuitively, as just a pet parent, right? That you very intimately as a veterinarian saw the intersection between pet health and parent health. Can you speak to what parallels you started to recognize right away in this pursuit with both your lost wife and your pets that you were caring for?
Well, I think it's no surprise, and quite honestly, those that are pet parents,
Mhm.
we have this incredibly um, deep and loving relationship with our pets. In the industry, it's called the human animal bond. It kind of seems a little scientific. We're scientists, we're healers. That's okay. For me, it's an energetic connection. And that energy that they bring into our lives is unconditional love. I truly feel that I describe our pets as they're a gift from God. They basically show us what's on the other side of the thin veil in what it would be like to experience heaven on earth. And so that's why they can they immediately create a sense of ease and caring and love and connection just by them looking at us. Like it's incredible the amount of power they hold over us humans.
Mhm.
So that's where I live. And when, a lot of times people think, well, I want to be a veterinarian, not a human doctor, because I don't want to work with people. And I get it, but there's a person attached to that. And very, very quickly you realize that the two are not separate. You cannot disentangle them because part of the things that are happening to one, the other is experiencing, and there's feedback continuously. And over time, you start noticing trends, and you see people that come in and they look like their dogs. I don't know if you've seen those YouTube channels with pitch. It's true. Like when you see hundreds and hundreds of patients and owners, there's resemblance. There's resemblance in the way that they behave, their demeanor, their energy levels. So they're little mirrors. I don't know who shapes the mirror more. The hope is that the pet is helping the person, which I truly believe is their function on earth for us. But there's spillover. So this connection is very very deep when you start paying attention to it. And I did start noticing that there were definitely negative energies and patterns that were occurring in a client that was also happening in the pet. For example, different tumors or metabolic conditions. I would go through the whole discussion and spiel, and after 5 minutes of explaining it, they would say, "Oh my gosh, Dr. Nations, I have that exact same problem. And I'll be honest with you, I didn't understand it. You told me so much better. I now understand what my condition is,
Yeah.
as well as my pets." But those occurrences were more and more frequent, where there was something more than coincidence.
Yes.
So, Nasha and I have talked a lot about this as the canary in a coal mine.
Yeah.
One of the things that's being passed around in medicine circles is, all right, well, how do we accelerate and try and find and, work out pathways and therapies and things like that in a faster way. And typically what ends up happening is it's from people, it goes from what's called bench side, which is the laboratory petri dish, and then at some point it makes it through. Usually it's a rodent model, so mice or rats, and then maybe there's a phase trial in people, but it basically goes from bench side to bedside. When I started thinking about the opportunities we have as veterinarians, we can be an intermediary, and with our pets, dogs, and even cats, we can go from bench side to cage side and then to bedside. And so we get this benefit of helping treat our pets, which is so very important. But from that information, we can maybe accelerate the process and get that information to people. And I think that's going to be a great, great opportunity. The scientific method has gotten us where we need to be, but it has become so slow. And quite honestly, the complexity of the diseases, the chronicity of these diseases, and when we start moving from allopathic medicine into essentially energy medicine, when we're talking about metabolic dysfunction, metabolism is the creation of energy, and all of these different processes are a result of a lack or a decrease in our ability to produce energy, which creates a stress state, and then the machine breaks. And then
Mm,
you get the four horsemen of death. So, what Nasha and I have been really studying and looking at is the terrain. What are those factors that are important in the health of our bodies? And I'm going to use the word bodies for animals and people.
perfect.
And how do we pull back, that so that we're not developing all of these diseases? I'll be honest, in veterinary medicine, veterinary medicine tends to probably lag human medicine by 5 to 15 years for
Mm,
obvious reasons. The amount of research and money that's able to be funded in human studies is very, very robust. It's not so much in animals. I will say that the effects of some of the things that hopefully we get a chance to talk on in a little bit more detail are so basically fundamentally simple,
right.
and it's like the Pareto principle. We make a couple smaller shifts and we get 80% of the results, which there are no medicines on the shelf. There are no vaccines. There are no therapies that we have that will foundationally impact our metabolic health and our ability to produce clean energy as food, water, air,
The essential.
exercise. Like
Yeah.
that's
Yeah. Doctor, it's funny because you talk about this overlay of how we can start to look like our pets and how energetically we can impact each other. I mean, I know, one of my dogs is actually being trained to be a hospice dog. She's very, very sensitive to energy. The other one is being trained to be a cancer sniffer. She's very, very sensitive to smells and discerning of smells. We know a lot in that space. So we know that there's just this utility of the pets being practitioners themselves. But in that correlation of how we start to look like and behave and impact each other from pet parent to pet, one of the things I know is really fascinating you right now, which I'd love for you to expand on a little bit, is this concept of the microbiome. Because what I've learned is that our microbiomes as humans are far more related to our animals in our household than they are to like a member of our own family, our own DNA genetic line outside of our household. Can you speak to that, which also alludes to what we're getting ready to dive into about this terrain impact, this nurture nature concept? But what have you been excited about in the microbiome world?
Yeah, so one of as I started on this journey, this cancer journey, and I really, um, I was very, very focused on essentially like cure cancer. Like somebody's got to do this. What does that look like? How do we move that? And it was a pretty aggressive anger. It wasn't. It was
Mm,
coming from when we feel and experience that, you just want to right the wrong, and sometimes, and it takes some of that emotion to get things rolling. As I
mm,
was studying and listening to the the people that were in this realm, and Nasha has been one of my dearest colleagues and mentors, quite honestly, along this own process, whether she realized it or not. We've kind of woven in and out of our lives over these last few years. But this concept of the terrain 10, and I mentioned, there's a number. Peter Attia mentions what he calls the four horsemen of death. And so
yeah,
in human health, that's cardiovascular disease is number one. Number two is cancer. Number three is neurodegenerative disease like Alzheimer's and all of those different conditions. And then four is metabolic syndrome or type 2 diabetes, which is actually part of the foundational principle of all of those. But as I
exactly.
was looking at and trying to identify therapies specifically for cancer, it ended up being things that I could see how they would apply to other areas. And I came up with this concept, and this is just at least the way my mind was working. Again, referencing Dr. Peter Attia, we've got health span and lifespan. So
Cool.
lifespan is how long we live, health span is how well we live. And I
Mm,
had conceptually thought about our health on a timeline or a continuum. So if you imagine on the far right side, that is extreme health. That's a fully optimized athlete. That's somebody that's just a machine. They're a beast. They are metabolically alive. And then as you pass through that line, you end up starting to erode or corrode or break down. That can be from age, it can be from poor nutrition and habits, environmental factors, stress, yada, yada. We know the grocery list that we're stressed with. And then
Mm.
at some point, the machine does break. And it just happens to be the part that breaks first is the disease condition that you're probably going to express. So whether that's cancer or cardiovascular, but there was a question that was posed by Dr. Walter Longo in a lecture that I heard online, and he asked how much longer would the human life extend if we cured all cancers? If we're
Wow.
75 years of age, how much longer? And people are saying 10 years, 15 years, 8 years. It's 3 years. And the reason for that is that if you've got cancer, you're also very metabolically deranged. And one of those other ones is they're waiting to get you again. And that I think is the foundational reason why the allopathic approach, where we're just targeting the tumor,
Mm.
it's not just the tumor, it's the environment, it's the terrain that Nasha's been talking about that's allowing that to occur. So whenever we have one of those dysfunctions, it is an alarm. It's an opportunity to pay attention. If your
Oh,
liver values are elevated, look at your diet. Okay, so the concept, though, that I think about is I think about your health line. What I described was where are you in health? And even in veterinary
good.
medicine, in veterinary medicine, we talk about wellness plans
Mm.
and general practice, and this is the same in human medicine. But really, what we're doing at that point is we're monitoring for disease occurrence. So we're
Mm.
kind of keeping an eye on things. We really have not done a very good job in specifically focusing on, okay, you actually are 30 pounds overweight. Here's your plan instead of eat less, go exercise. I'll check you in 2 years, right? So I think that's where the opportunity exists. Now, to bring this back to how this factors into the terrain 10 piece, as I was experiencing studying probably the most complex of the chronic degenerative conditions in cancer, I realized that every single thing that we were doing to a very, very large extent would affect all of the others and slide us back on that health line to a more optimized state.
Mhm.
So everything that needs to be shifted is now not how do we cure cancer, how do we optimize health? And
Mhm.
that's where the metabolic piece is so foundationally important.
Yeah.
I haven't forgotten about the microbiome because we're heading into the dirt right now.
Yes,
But
literally the
come down
soil
the
itself.
tree, right?
Yeah.
We come down the tree, and in the soil of the planet of Mother Earth, that's where it starts. So, all of the things that Zach Bush is doing and looking at soil and glyphosate, super important. In our gut, in our soil and terrain, what we notice, and this has been over the last 10, 15 years, the 2000s to 2010 was called the year of the brain or the decade of the brain. We learned more in medicine about the brain than we did in the previous 100. The next 10 years was basically the decade of the gut. And so through genetic analysis, RNA sequencing of bacteria, now we can get entire pathogen panels or bacterial pathogens. It's amazing. I mean, I graduated as a microbiologist prior to
Mhm.
going to vet school back in the late 80s, and we were culturing out salmonella and E. coli on little petri dishes. We had no idea what was going on in the gut. Now we can do genetic testing and do a little tiny pea-sized sample, and we do that in veterinary medicine. There's a couple different companies, one that I have no financial affiliation with, but I really like, a company called Animal Biome, which they've got a beautiful, great website. I would have people go there to learn a little bit about the microbiome in animals specifically. But what we're finding when we're doing these testing on these samples is that the gut microbiome is just wrecked.
Mhm.
It is such, and I'm not sure. I haven't seen the information specifically in people, but when I look at what's going on in our veterinary patients, it's not good. We have good bacteria, bad bacteria in normal. I describe our gut microbiome as thousands and thousands of species that's in a very complex ecosystem, almost like the Amazon rainforest. And when you start losing species, you start eroding the health of that system. And I see animals that have no measurable good bacteria and wicked overgrowths of really bad bacteria, Clostridium, Shigella, E. coli. And it's amazing. And some of them look normal. They
Like
have pretty
normal
normal.
outside. Right.
Yeah, they're younger animals. They look pretty normal. They're acting pretty decent, but they're eating bags of kibble. And it's not but a matter of time before that something's going to break. And I always tell my clients, they're like, well, how come I've been feeding this food and he's 8 years old and he looks pretty good? And I always say, look, you can eat McDonald's for a
Right.
long time, every day, as a matter of fact. You may make it to 50, but you're not going to make it to 100. So
Yeah.
it's the same thing. At some point, it's going to break. So back to the animal, the microbiome. One quick observation, which I think is important, is that the gut microbiome, as I start describing and talking about this with clients, we have two things that go into the tube. Okay, our digestive tract. We have our food and what's in that, and then we have the gut bacteria that are in the gut. We have some digestion from the pancreas. We have some enzymes. But those are the two foundational things that go into the milieu that then end up breaking down those energy components, and then they're absorbed through the gut membrane. The bacteria are vitally important for that process to occur and for that gut membrane to stay intact. At the end of the day, the chemicals, the things that end up getting in our food through the
Mhm.
processing of commercial processed food, the substrate that we're starting with the food, the abnormal bacteria, it sets up a perfect storm for maldigestion, malabsorption, severe inflammation, leads to leaky gut. Leaky gut then fires up our immune system. Now our body's on fire. And that's why we see dogs with so many allergies and gastrointestinal problems and nausea
Skin,
and loose
condition,
stool, all of
anxiety.
those things.
Yeah.
Anxiety is unbelievable. And through diet, we can actually treat anxiety. It starts there, just like in people. And we were just at the conference, and there was a great presentation by a MD that wrote a book called Brain Energy.
Dr.
Uh,
Yep.
yeah,
Yep.
Chris Palmer, and brilliant. And now, the chemicals and enzymes that are produced in the gut affect our brains. I mean, our bodies are
Ugh,
connected. We need to stop thinking about them as individual little
absolutely.
components, parts of a machine. We need to start thinking about them as an energy being. And what does that look like?
Well, and Lauren, this is one thing you see a lot of people feeding from the table their food to their pets as well. And so there's that the pets are literally eating exactly what we're eating, which should probably be telling you something. If you've got a sick pet and you might be sick, you might look at your plate as well as their plate to start with here. But that's where I think you're starting to show, like, even if they're keeping them 100% on a pet food and not feeding them scraps off their own table, the quality of food is just as diminished and problematic in the pet world as it is in the human world. And so we've alluded to now a lot of the symptoms or ailments that can arise from just a poor gut function, which happens both in the human side, even the soil outside of our body side, so in the farming agricultural side, as well as in the animal side. So what are the most, like, we have a few questions that have come in from some of our network, from our listeners here, and I've explained to them that just like in the humans, we can't diagnose or treat when we have these conversations because there's a lot of context that goes into this, but there's some fundamentals that we can talk about. And one of them, I think, just let's set the stage for what it is that you and your colleagues today see as the most common ailments in general in the pet population and the most common cancers, and what you're noticing with regards to cancer incidence um, over your practice over the course of these decades.
Yeah, sure. So, first of all, I want to just preface this by saying that I'm not a board certified nutritionist. And the amount of information that's in the veterinary nutrition realm is immense. And everybody that's in that realm has been using that information in the best way possible, without knowing some of the things that we're talking about right now. So as we start thinking about, first of all, how did that come about? How did we get where we are? I think that's a good little talking point, and I'll mention that. I'll start with an answer. What are some of the things that we see most commonly? Certainly, the things that are very, very common. My practice, we have a large referral specialty emergency center and general practice. We see a lot of different things. I think that actually gastrointestinal, so nausea, vomiting, diarrheas, those are by far, from a general practice standpoint, the top of the list. From
Which
that, we
tell you
see
that's probably something they're eating or not eating, right? Right.
exactly. If we go to the gut, all right, what's going on in the gut? From there, it tends to be allergies. So now we see, on a general standpoint, just very, very itchy, chronic ear problems, skin, things like that, which is an inflammatory process. And then from there, certainly as we are seeing all of the same conditions. We see metabolic dysfunction. We see type 2 diabetes in dogs and cats, which is increasing in the number. We see cardiovascular disease, different than humans, but still there's a tremendous amount of cardiovascular disease in dogs and cats. And then cancer. And cancer is, the number one killer of dogs and cats. It has been since 2000. And
Wow.
in humans, they expect cancer potentially to overtake cardiovascular disease
It
in the
just
next
did.
few years. Did it? Just took it. Well, guess what? We beat you guys to the finish line almost 2.5 decades before. Not to be proud of that as a veterinarian, because that's as devastating in our pets when they develop cancer as it is in people. But I think that that's, again, that canary in the coal mine concept. So if we think about all of those conditions, where did that start? It started in the gut. So
Mm.
if we're starting to see pancreatitis, and when I graduated from vet school, we had cats that were chronic vomiters. And at the time, that was actually normal. Cats get hairballs. Yeah, they vomit all the time. Well, cats don't vomit all the time. Like, there's a reason why there's such severe inflammation where you feel like, you're nauseous. And we see that in dogs and cats. People, for us, food is love. Like, we want our animals to enjoy their meals. And so when they don't eat a meal, we get upset. And I have a lot of clients that they call up and said, "Oh, Sparky, he didn't eat his dinner. Like, I'm really worried. Do I need to bring him in?" And I'll ask, "Well, what does he eat? Does he eat?" Well, no, sometimes he eats. He kind of smells his food and he walks away. Well, give him just a little bit of some chicken and rice, just something a little bit, not too much. See if he's interested in eating it. And I used to do all my own emergency calls, and I'd have them call me back. "Oh my God, he gobbled it down. Like, he couldn't get enough." Well, there's a reason. All right.
Trying
It
to
was
tell you something.
the well, dog's sense of smell is 800 times that of ours. They're smelling some stuff in that food. When we open a bag of kibble, it doesn't smell good. Like, all right, if we can smell it,
Yeah.
it can't be so palatable for a lot of our pets. But
Mhm.
they do. Diets are made to become palatable, and there's tons of therapies and techniques as to how that can occur. So I want to jump into a little bit of nutrition, because this
Good,
is
good.
where
It's a
it's
hot
going to
button
get.
topic.
Yes, we're going to get down to the weeds a little bit on this. This is such a polarized topic. It is amazing to me just how crazy the line has been drawn. Like,
In the
no
human
raw,
which is
no,
what's
yeah,
crazy.
it's like politics. Oh my gosh, like, are
Mhm.
you red or blue? Kind of think about the
We used to
Dr.
say
Seuss
don't
book.
talk religion or politics. We also
I,
just say don't talk religion, politics, or
oh,
diet because
yeah,
that
don't
seems
talk diet. Yeah. So, and I'm even going to go keto, which is going to, anybody that's a veterinarian is going to absolutely, they'll just probably turn off the podcast. That's okay. I'll catch up with them somewhere.
there you
Uh,
go.
but I think that, as far as this question, I don't want to pick a side or to make a statement or a generalization without us understanding the reason why. Okay.
Mm.
So part of that is, how did we get where we are? How did we get to the point where everything that, as veterinarians, unbelievably caring, compassionate veterinarians, very highly trained, boarded specialists. We're in this structure where it's if you don't recommend or feed one of these commercially prepared, maybe high end diet, there's premiums in there that are lining the veterinary hospitals, and those are our go to, and they're therapeutic prescription diets, things like that. How do we get there? Well, initially, there's a great book. I'm going to reference this for people that are interested in this. It's a book called Big Kibble, and Big Kibble is basically it's a description of, well, where did we get where we are, and what's this whole process? And I'll touch on a couple of the points in the book for anybody who's interested in that. It's a very, very, I think, honest and realistic assessment. There's a little bias here and there, so just read it with open ears and heart, and you'll get the information out of it. In this process, basically, kibble started off as a cheap, easy way to provide nutrition before they even understood what good nutrition was. It started off essentially as a treat, and it was very easy and complete, or it was tasty and palatable, and you could travel with your dogs. This is back in the 40s and 50s. So that's where it started from. It basically, milk-bone dog biscuits were the first, I believe, product that were allowed on the shelves next to human food in grocery stores. And then the market existed and was created from kibble, and the convenience and the palatability to the animals, all of those things set up a scenario. And then there was looks like a shift where there was some very, very effective marketing that then led people to eating these different or feeding these different forms, and it created the paradigm that then veterinarians were taught about. So, not to give good or bad, this is not conspiracy issues. This is just kind of the history. So fast forward now as we're starting to think about inflammation or gut issues, gut microbiome. These are concepts that weren't even on the radar back when those diets were potentially created, or even when I graduated, which was James Herriot. He was, he was my mentors in print, at least. But anyhow, so fast forward now, and what we're learning is that we can look at these different diets, and I'm going to pick on kibble a little bit because I think that's a foundational piece, and canned food is the same. You we start off with what's called feed grade ingredients, which is everything that is human grade, and that goes to people. Everything that's left over on the slaughter floor, that gets scraped into and goes into the pet industry. And then there are a lot of different other things that can make it into that pet food. Some of them are not so savory, so they call them the 4Ds: death, dying, diseased, or dying. And so literally carcasses, and it's not great to hear about that. And unfortunately, all of these things go into the system. They go to rendering vats, and then the way these components are essentially sterilized or sanitized is they're cooked at very high heat, temperatures, and pressures. And through actually that process, not just what may be in the food, whether it's pesticides or toxins or herbicides like glyphosate, but the actual cooking of those components, there's a chemical reaction called the Maillard reaction, which is a chemical reaction between proteins and sugars. It's called glycation, and they develop or what are created what are called advanced glycation end products, or AGEs. These are some of the most inflammatory molecules we know. They're carcinogens. If anybody has ever heard, don't eat your steak charred because you get cancer from it, it's that charring, that's the AGEs. So that sets up the stage. Okay, now we've got a diet that potentially may be somewhat inflammatory if these molecules are in it. On the human, yeah, which they are. So on the human side, and in this book, referenced, and I've talked to the researchers, there was, in this realm of the gut microbiome and whatnot, AGEs popped up on the radar in research. And if you go to PubMed, there's hundreds and hundreds of articles on AGEs. And AGEs, there's direct correlations when we start looking at the level of inflammation and also the occurrence of disease. And some of the conditions that we see, diabetes, cardiac disease like dilated cardiomyopathy in people, neurodegenerative, all of that stuff, AGEs tend to be a part of it, which makes sense because the more highly processed the diet, the more likely or the higher level of AGEs are from the processing piece. So, okay, that fits pretty, don't have to be a scientist to kind of figure that out.
Right.
The question was, okay, well, if that's happening in human nutrition, what's going on in our pet foods? So, some of these researchers, boarded nutritionists, by the way, at universities, started looking at this concept. They grabbed 65 random bags of pet foods from all different brands and types, top shelf all the way down. They analyzed the AGE levels, and what they found was astounding. They found that on average, the amount of AGEs in those pet foods that we, as loving, caring pet parents and nurturing healers in the veterinary profession, are feeding our animals, 122 times higher than what was deemed
Wow.
healthy for people. Oh
Whew.
my gosh. So
We're
all of a
definitely
sudden,
across like the high end, expensive, good labeled brands to the cheap, no, not much of a differentiator about these
and I
AGs.
don't know the exact numbers, I'm sure there's variability, but again, the concept of, all right, the way the food is being processed from a commercial standpoint with feed grade ingredients, that's a little broken, right? And if there's an awareness now, we can start figuring out how to fix that. Um, so if that's the case, and we're dealing with all of these inflammatory components, foundationally, what are the things that we need to think about changing?
Great.
So one of them is the food source. Like, we've got to start upping the grade of what we're feeding our pets. When you look at it, I wouldn't want to feed that to my child. I wouldn't want to feed that to my enemy. I mean,
Right.
it's not necessarily a good thing. So, okay, what do we switch from? Well, why don't we start with some type of a feed grade or a less highly processed? So let's just start moving the dial in that direction on the health line.
Right.
There are now foods that are focusing on human grade food. So you guys have heard the commercials. There's a company called Farmer's Dog, which
Yeah.
they had an ad on the
Lots.
Super Bowl. One of I love their product. I also have a strong affiliation with another very, very similar diet. The two of them called Just Food for Dogs. And
Oh,
they're
cool.
very veterinary centric. Both of them have excellent websites. I'm
Okay.
not pushing anybody in either direction specifically, but that conceptually, now we're starting to think about human grade. So what about us fixing food? Absolutely.
Yeah.
The part of the sticky wicket for veterinarians is that we've always been concerned, well, is that going to be a 100% nutritionally complete diet?
Right. We
And
get
that
that.
really is going to require you, if you want to fix your own food for your pet. First of all, Just Food for Dogs, they have a do-it-yourself page. So they share their recipes. They are so excited about getting pets eating healthy that they share their recipes, and they have supplements that allow you to prepare at home and then add the supplement, and you have a 100% nutritionally complete diet. I've seen incredible changes in pets' health just from that.
Cool.
Although we're going to come back to the microbiome because the two work together. And if you only fix one, you're missing the boat. And so, well, how do we do that? Okay, we'll come back to that in a minute.
Love
From a
it.
food standpoint, so we talked about, all right, let's start feeding a human grade source. Okay, and
Yeah.
there's a couple of companies that I just referenced. Uh, and then the others, okay, now we're gonna trip the wire. And okay, well, what about raw, right?
Yeah.
I
Exactly. Ooh,
don't know how raw became so demonized.
right.
I
I mean, most animals
understand.
came before the kibble industry. Like they were,
Yeah,
like my grandmother talks about, there was never a pet in her house. They all lived on the land. No one fed them. They scavenged for their own food, from cats to dogs, everything in between. There was the only thing they ate was raw,
yeah,
whatever
yeah,
dead
exactly.
or whatever they found. So I'm just like, how did we get so far from what was to what is?
Well, I think there's some confounding factors, and actually, there are some that are quite legitimate. So one of them, probably the biggest one that I think is actually a real scenario, is contamination of the food source to the pet parent. So,
Okay.
being immunocompromised or whatever, these things that are coming out, you buy a thing of chicken at the grocery store, it's in that kind of soup. There's a lot of bad stuff in there.
Yeah.
So we want to be careful. That's just food prep. So that's being cautious as far as what we're feeding. There are proponents, not wrongly, to say when we cook foods, it's nutritionally easier to digest. That's not wrong. I think it's in the cooking, and both of those diets I just mentioned, Farmer's Dog and Just Food for Dogs, they're lightly cooked. So they're cooking that. They're trying to make sure that it's sustainable. They're aware of the AGE levels as well. So I don't have any problems with cooking. I think that the raw component is very important when we come to the concept of less highly processed. And I will reference and mention a company called Instinct Raw.
Yeah.
And Instinct is, again, it's formulated by an incredible veterinary nutritionist. She's very holistic. Her name is Dr. Susan Wynn. And
Oh,
she's conscious of this component. One of the things, there was a study out of the University of Helsinki called the Dog Risk Study.
mm,
And in that study, they were looking at raw versus kibble. So just really quickly, the construct was they had dogs that were eating raw and dogs eating kibble. They measured inflammatory markers, what's called homocysteine. And I may be making numbers up a little bit, but if the normal level for homocysteine is 1 to 3, the dogs that were eating raw were in the normal range. Dogs that were eating kibble were they were actually 15 to 30. So they were quite high as far as inflammatory markers. They flipped
interesting.
those diets. The dogs that were on raw, they started eating kibble. Their inflammatory markers went up, and vice versa. So there was a correlation, it seemed, at least to the food sources, to the inflammatory markers. The really
Mm,
brilliant part of this that I thought was quite interesting was that they also then looked at, okay, well, is it an all or nothing kind of deal? Like, do they have
right.
to eat all raw, or can we
Mm,
eat some? And when we think about our health, less highly processed, we eat a nice raw vegetable salad, and then we eat a nice piece of lightly cooked meat or whatever else it is. You can be pretty healthy in that scenario. So when they found the results, they broke it down in increments of 10%. So
okay.
10% raw, 90% kibble, 20% raw, 20% kibble, on down the road. And what they found was, again, the Pareto principle always pops up. They found that with as little as 20% raw in the formulation with the kibble, they got a very significant and impactful decrease in the inflammatory markers.
Cool.
Why is that? I don't know if there's some components that when the foods are cooked, we lose phytonutrients or live enzymes in food sources, vital energy. There's a whole bunch of different things that we could be missing when we don't eat that. And then when you think about that compounded over never, ever, ever having anything raw with any liveness on your plate for a decade, it just makes you wonder, all right, maybe that's part of the reason why we're developing cancers at such a high rate.
Interesting.
So
Mm,
the question, and this may be a little nebulous because quite honestly, this is a work in progress. And one of I feel like my missions and responsibility as a veterinarian and to our pet parents and my patients is figuring this out. So
great.
I think that the problem that we have on the veterinary side is that we don't have tests or biomarkers yet to allow us to see what are these inflammatory markers looking like. And if we change therapy, what is the response? So we
Love.
need to be scientific in our exuberance,
Yeah.
because everybody wants to feed the very, very best. I wish I could tell you. It's just like in human medicine. What's the best diet, Dr. Nasha?
What's best for
That's
you in any
that's what I
moment on your metric. Yeah.
exactly. So it's no different for our little furry patients than it is for people.
Love it.
And I definitely see animals that do well on diets that don't seem so savory. And,
Mhm.
animals lived 17, 18 years of age eating kibble. Well, that's great. Could they have lived to be 25? Like, were they optimized? We see animals that are in countries that have much higher feed rates of raw diets, and they're living into their 30s,
Yeah. Oh,
right? So
Yeah.
So, what is the opportunity to optimize? And when we optimize the health, we decrease the occurrence or postpone the
Mm,
occurrence of disease.
I love.
And
Yeah.
yeah, so that's a big part of nutrition. Uh, so there's a whole bunch of I know everybody's super excited and just is ready to know. Okay, what supplements, what
Yep.
components do we give?
Yeah.
And I'm gonna push pause on that. There's a lot of things out there, but again, it does become quite personalized. So my the low hanging fruit, which any pet parent that is listening to this, I would think about those two components. Okay, what kind of food am I feeding?
Mhm.
The other thing that's very, very difficult in the pet food industry is that we don't even have the ability to look at the back of the bag and know exactly what's in that
Yeah.
food.
You don't have to say everything that's in there.
You don't have to say everything. And if you go into the grocery store, you will not find any bag or can of food that actually tells you truthfully and to your face how many carbohydrates are in that food. And carbohydrates are kind of a dirty little secret in the standpoint. Like, why don't they do that? It's not that difficult. It's a calculation. Like if we go on Weight Watchers and we go to count calories, we can flip over a bag of anything in the grocery store to tell you all those different things, even the
That is
fiber content on down, sugars added, all that.
wow.
Part of that is because there are very, very high levels of carbohydrates, and a lot of them are outside of the realm of what we would consider to be evolutionarily
It.
appropriate for a species. So I'm going to jump to our kitty patients. We
Yeah.
haven't talked about our kitty cats yet. Cats are obligate carnivores, and so
And
when we
define that. A lot of people like, what does that mean exactly?
So for a cat, their enzymes and their metabolism is designed to eat meat, which is essentially proteins, fats. There's other components within there, but carbohydrates are not an essential nutrient in a cat. They're actually not an essential nutrient in a dog or even a person. Omnivores are species that have adapted to and have metabolic flexibility in what we take in as an energy source. So whether that's fats, whether that's fruits and vegetables, carbohydrates, starchy carbs, complex carbs, and proteins of all sources. So we have the ability to utilize whatever's available. And for carnivores, obligate carnivores, if you gave a cat and put him in a pasture with a bunch of grass, he's going to die. Like I don't care how much grass he eats, he's going to die. And the problem is that there are animals and species that can tolerate fats or carbohydrates better, and the carbohydrates in cats, when it's cooked, it can be absorbed. So they can get that as an energy source. The problem is that enzymatically they don't have enzymes in their liver specifically, and their insulin levels and their glucose uh, their ability to dispose of glucose and get it out of the system is very, very blunted compared to an omnivore. So our kitties, when we look at the macro content for cats, they should be less than 5% carbohydrate. Their diets out there that are less than 2.5%. That's actually in an analysis about 2.5 to 5% carbohydrate for kitties. And in a feral situation, that's those kitties eating some of the ingesta out of the prey item. So you got a little mouse who's been eating a bunch of grass and hay. That's part of the carbohydrate. And they eat that for some vitamins and minerals and things like that. We are essentially feeding our cats
Mhm.
diets that are anywhere from 40 to 70% sugar
Wow.
or carbohydrates. So, you think of the typical Garfield, the lasagna eating orange tabby. We are literally creating Garfields by feeding them lasagna every day. So, that's a piece that's very, very important. So I do also, and this is very important when we're talking about cancer. So when we talk about cancer and diets, we're using diets therapeutically, not only from a health wise standpoint. So if we start sliding into a ketogenic type of mindset, or what would that look like in our veterinary patients? Okay, now we're there. Like we're at the doorstep of what that looks like. So I
Well,
don't
you've
know.
been No, this is so good because, like, even so recently, UNC. So there's some projects that your organization, our organization, are looking at doing in the animal testing to help get the answers that you're inquiring about in your population, as well as what we can learn about the animals in our population. Because in our rat and mice studies, those are when we study cancer in those and try to apply it to the human. When you work with mice and rats, you have to give them cancer. They don't automatically create the same cancers in their bodies that we do. We have to go to great lengths to actually induce a cancering process within those creatures to then study and apply back to us. However, in the realm of dogs in particular, they organically create the same or very similar cancers that we do as humans. So there's a lot closer correlation and research that can be done there. And there's a lot of exciting things I think we're going to do together, Dr. Nations and your group and our group, of like looking at that, because we can both be helping the pet and the pet human simultaneously. And one of the things you started doing early on in your learning of this new information was applying things like therapeutic ketogenic diet to pets, applying extra pressure with hyperbaric oxygen, applying mistletoe injections, applying off label drugs, applying appropriately matched supplements based on the metrics that you do have with this realm. And so, what I think is exciting is mentioned, it's like the fundamentals have to be addressed: quality of water, air, soil, food, even care, the energetic field in the home. The stress in the environment is just as impactful on your animals as it is on you as a human. So those terrain 10 issues we talk about and evaluate for humans also get applied to our pets in our state that share our homes with us. And so one of the things I think is really cool of what you're creating, and I want you to tell us now about what you see on the horizon for where you're going with this. I mean, first of all, I've had the privilege of actually touring your beautiful hospital and facility. You guys are creating like the MTIH campus. We'll someday have this vet hospital model on our campus, and someday we hope that we have a human hospital component on your campus. But you're
Absolutely.
basically, we're doing like parallel lives here. I mean, it's absolutely beautiful. You have a cafe, you've got a dog park, you've got this beautiful, like, the animals come in. It is a beautiful healing place to just walk into. You have thought about all those details that immediately put both the patient, being the pet, and the pet parent at ease and into a space to accept healing the moment they walk in your door. So I know that's a small part, but what's the big vision for you? Where are you going with this? And where can we learn more to follow you on this journey?
Yeah, so my our mission statement at my hospital, which is Veterinary Healthcare Associates, is helping people, pets, and planet become healthy, happy, and healed. So
Mm,
within that mission, we've created this link, that goes from us to our pets and back to planet as well, which is part of the Metabolic Train Institute of Health. From soil to soul. So that we're just all part of that line.
mm,
Within that capacity, uh, I think that we need to think about, and we need to reinvigorate community, and we also need to relearn compassion. And in the veterinary profession, compassion is a huge part of what we do, but it's also a huge challenge in any of the healing professions. That's the case. So my vision is leaning into these different components and figuring out how do we, as a community, and I always reference and think about the pet community. Those are the people that are in this space, and that's such a easy thing. People meet their partners from pet web pages, or if you're in the park and you've got two little Frenchies that come together, all of a sudden we've got a little marriage waiting to happen. So it's incredible how our animals can really lead us. And in the same sense, when we're taking care of and understanding what that looks like for them, almost by osmosis, that can occur in people. And I realized very early on in my profession, or in the course of my profession, that I had an ability to impact people as much as animals. And it ended up merging from being, I'm treating a pet, and that's my primary responsibility. And I also am communicating with the pet parent,
mm,
to then I'm actually, you know, helping to heal the pet parent in a sense, or dealing with that on a deeper emotional and energetic level.
Mm.
Now they are one and the same. And I see, and I think about that from a standpoint of how do we treat this relationship, this energetic unity, which, if you think about it in that aspect, is also uh, that's occurring within our families. And so if we've got an animal that's developing some form of cancer, and oh, by the way, the pet parent has the same condition,
Yeah.
what about everybody else that's in that household? So, we need to start paying attention to that. And this is one of the things that, you and I have talked about, as far as like, how do we stitch this together? Like, there's data out there. Now we've got AI platforms where we can start creating some opportunity to look into that, and
Yes.
and how do we affect that? And so that's, I think, where you're in my path has been so aligned incredibly. Like when we talked after a couple years during COVID, she's building a practice. You're building your metabolic terrain institute of health hospital. I'm building one for animals, and it was just incredible. I still get goosebumps thinking about that conversation. But we kind of came back from out of the stars, and we're like, "What are you doing? What are you doing? Oh my gosh!" Like, so very, very cool. So I think moving forward, as far as the opportunity, there is so much easy work that can be done for our pets. Nutrition is a huge component of that. I can't stress enough that the gut microenvironment, the gut microbiome is very important. That's very, very rudimentary. We're just getting started with that. But even with those two tools, in the cases that I see, which are advanced conditions, I typically do specialty referral in internal medicine, oncology, and even a little cardiology, just because nobody else in the area really does it. I'm not boarded in any of those, but I have been practicing and doing those for decades and decades, and we've been treating and using a lot of these types of therapies along with the tools that we have in our toolbox from Western medicine. So, and I think there's an opportunity to start looking at, okay, what are the tools that we have? In a cancer case, do we use chemotherapy? There are definite cancers where, yes, we do, but we have to mitigate the effects of that and make sure that we're not neglecting the terrain and we're healing that as well as being tumor centric. There's a part for that. And so I think that that's a huge opportunity. I think there needs to be an awareness. There's definitely a desire. I think we have to be somewhat tempered in our recommendations and running enthusiastically in the wrong direction without having a little bit of some scientific
Right.
guardrails.
Yeah.
I don't think that the structure of what we're doing now is going to get there fast enough. And the complexity of some of these disease processes will never be fixed by turning one dial. So we need
Right.
to have a number of tools. We need to be mindful in targets, terrain, all of those pieces.
Cool.
Um, what the reason why when Nation and I get together with the groups, it's like an explosion of fireworks and synergy in what we can create, and it's a brand new time thinking about a new way, a new creation of the concept of how we treat, and then the delivery of medicine, and then the optimization of those therapies. I will say that some of these factors, we don't have to reinvent the wheel. We just have to go back and look at what was foundationally done previously and then add in what we already know now. And that's the way we're going to accelerate this process. Um, Nasha mentioned that we're interested and we're developing. It's called the Bioenergetics and Metabolic Health Institute for Veterinary Medicine. That's going to be coming around the corner in the next quarter or two. We've got some incredible people that are lined up to join us in that path.
Amazing.
This figuring out low hanging fruit pieces like nutrition. There'll be more information to come. Before this podcast, Nation and I were talking, and
Mhm.
this is my very first podcast, and
I
this is
know you're a
other
natural.
than
Welcome.
standing on stages, well outside of my comfort level in audiences and auditoriums of gurus in areas that I'm just a little newbie.
Mm.
Uh, this is the beginning of some generation of information for those who are listening and for their pets. So stay tuned for that. We were talking, if you do want information on where to see where we're practicing, our website is veterinaryhealthcareassociates.com, vhavets.com. If you Google Veterinary Healthcare Associates, that'll take us to our hospital, and you can take a look on the website. We will be putting up some information so that we'll have some socials out there. I don't have any socials. I'm kind of one of those that's been locked
We're
in a
pushing out there in the world.
I've been in a vacuum of, negative technology. I love technology, but I just don't have enough time to spend time learning about it. It's kind of my process. But I've got young millennial children and Gen Zs as well. Thank you, who helped
I
set me
love
up for
it.
today.
Dr. Loren, this is so amazing. Like, you are branching into a whole new world. You are being a thought leader and a trailblazer. You and a couple of other really brilliant veterinarians on this same path that are going to make these conversations more and more household conversations. So I'm grateful to you. I'm grateful for your passion and purpose. I'm grateful for our connection and collaboration. And I'm very much looking forward to seeing how we do exactly. I want you to leave us again with your mission and vision statement from your business, because I think it says everything in closing here. So leave us with that.
Yeah. I just think it's so important for us to come again back to community, and part of that, I feel like this process that we're all on is an evolution in our consciousness. And so, what does that mean? Consciousness comes back to, the things that are most important, and community, relationships, love. And from that, over several decades, we came up with our mission statement, which is helping people, pets, and planet become healthy, happy, and healed. And so those are foundationally easy to talk about. We get lost in the weeds a lot. And if we come back to what's simple, that's talking to, your loved ones, that's petting the brow of your furry little pet who's sitting next to you and spending some quiet time, just absorbing the energy and the love.
Thank you for being such a beautiful human being and for sharing your wisdom with us.
Thank you.
Thank you for joining us for this episode of Metabolic Matters. We hope you found today's conversation insightful and empowering. As we wrap up today's episode, we want to take a moment to acknowledge the incredible team and supporters who make this podcast possible. First, we'd like to thank our production team, Alex Sanchez, Cindy Kennedy, Jessica Gilman, and Lynn Hughes, for their hard work behind the scenes. Our theme song was written by Julie Newmark and performed by Whiskey Flower. And finally, we want to thank you, our listeners, for tuning in and being a part of the Metabolic Matters community. Do you want to learn more? Please visit our website, metabolicmatters.org, and you can follow us on Instagram. If you liked this episode, please leave us a review and share it with your friends and family. And if you want to help support our mission, spreading awareness and knowledge about metabolic health, reach out. We'd love you to join with us. Also, don't forget to subscribe to our channel and hit the notification bell to stay updated on upcoming episodes. We have so much exciting content coming your way. Until next time, stay curious, stay empowered, and remember, your metabolic health matters.